Patients on dialysis are typically on a 3 days a week schedule. Treatment usually lasts for 3 to 5 hours. What you do before your patient has dialysis can make all the difference in how well your patient responds to the treatment. In some rare cases, what you do or don't do can even make the difference between life and death. This is why it's very important to make sure you understand what should and should never occur when preparing your patient for hemodialysis. Here are some general things that should be done before a patient undergoes hemodialysis. Take vital signs. Before the dialysis session, it's important to check the patient's vital signs, including blood pressure, pulse, and temperature. Weigh the patient. It's crucial to weigh the patient before and after the dialysis session to monitor any fluid gains or losses. Review the medication list. The healthcare provider should review the patient's medication list to ensure that there are no contraindications or potential interactions with the dialysis treatment. Assess the access site. The access site, whether it's an arteriovenous fistula or graft, should be assessed for any signs of infection, clotting, or other issues. Check for allergies. The patient's allergy history should be reviewed to ensure that there are no allergies to the dialysis materials or medications used during the treatment. Determine the treatment parameters. The healthcare provider should determine the length of the treatment, the dialysate flow rate, and the type of dialyzer to be used. Prepare the equipment. The dialysis machine, tubing, and dialyzer should be properly set up and checked for proper functioning. Monitor the patient during treatment. During the dialysis treatment, the healthcare provider should monitor the patient for any signs of adverse reactions, such as hypotension or cramping. Follow up with the patient. After the treatment, the healthcare provider should follow up with the patient to ensure that there are no complications or issues. It's essential to ensure that the patient is in optimal health before dialysis to ensure a successful treatment session. Any deviations from the standard protocol should be communicated to the healthcare provider immediately to prevent any adverse outcomes. Review the patient's medical history. It's essential to review the patient's medical history, including any previous surgeries or medical conditions that could affect the dialysis treatment. This can help identify potential risks and prevent complications during the procedure. Monitor fluid intake and output. Before the dialysis session, it's important to monitor the patient's fluid intake and output to ensure that they are in a stable state. This can help prevent complications during the procedure, such as hypotension or electrolyte imbalances. Ensure proper disinfection. All equipment and supplies used during the dialysis treatment should be properly disinfected to prevent infection. This includes the dialysis machine, dialyzer, tubing, and access site. Address patient concerns. Patients undergoing dialysis can experience anxiety or discomfort during the procedure. It's important to address any concerns or questions that the patient may have to help them feel more comfortable and relaxed. Provide adequate pain management. Some patients may experience discomfort or pain during the dialysis treatment. It's important to provide adequate pain management to help alleviate any discomfort and promote patient comfort. Monitor blood glucose levels. Patients with diabetes may require additional monitoring of their blood glucose levels during the dialysis treatment. This can help prevent complications related to blood sugar levels, such as hypoglycemia or hyperglycemia. Overall, proper preparation before dialysis can help ensure a safe and effective treatment session. It's important to follow established protocols and guidelines to prevent complications and promote positive patient outcomes. Evaluate the patient's nutritional status. Patients on dialysis may have specific nutritional needs that require attention. The healthcare provider should evaluate the patient's nutritional status and adjust their diet accordingly to ensure that they are getting the nutrients they need. Assess the patient's mental health. Patients undergoing dialysis can experience emotional distress, depression, or anxiety. It's important to assess the patient's mental health and provide support as needed to promote their overall well-being. Monitor for signs of infection. Patients undergoing dialysis can be at risk for infection due to the presence of the access site. It's important to monitor the patient for signs of infection, such as fever or redness, swelling around the access site, and take appropriate measures to prevent or treat infection. Address medication adjustments. Certain medications may need to be adjusted before or after dialysis to ensure their effectiveness and prevent adverse effects. The healthcare provider should review the patient's medication list and adjust dosages or schedules as needed. Review patient education. Patients undergoing dialysis should receive education on how to care for their access site, monitor their symptoms, and manage any potential complications. The healthcare provider should review this information with the patient and answer any questions they may have. Ensure adequate staffing. Dialysis requires a team approach, and it's important to ensure that there are enough staff members available to assist with the procedure and provide any necessary support to the patient. Overall, preparing a patient for dialysis involves a comprehensive assessment of their physical and mental health, along with attention to details such as infection prevention, medication adjustments, and patient education. By taking a thorough and holistic approach, healthcare providers can help ensure the best possible outcomes for their patients on dialysis.